Okay, now through this morning we've had Victoria, New South Wales, Tassie and Queensland report their numbers of new confirmed cases of coronavirus. There's been a bit of a mixed bag in terms of Victoria and New South Wales, more than 20, but none in Queensland and 2 in Tassie. So to go through these figures, let's bring in ABC analyst Casey Briggs now. So Casey, yeah, take us through these numbers and how much concern should there be about the fact that I think it's 5 of the 9 cases in New South Wales, the source is unknown, and 6 of the 17 new cases in Victoria, the source is unknown as well. And what does that mean about COVID-19 continuing to move through the community?
Yeah, g'day Joe. You're right, it is a bit of a mixed bag today, and it's worth remembering that not all coronavirus cases are necessarily as concerning as each other. So we're seeing 26 new cases today across the country so far. That is one of the bigger numbers that we've seen in recent days and weeks. I should just say Tasmania's 2 cases that you just mentioned, they were first announced yesterday, so they're not going to show up in today's numbers. Tasmania reports quite late in the evening, so they were first announced yesterday but discussed this morning. But 26, 9 of them in New South Wales and 17 in Victoria. Let's break down Victoria first. 4 of those associated with the one abattoir cluster that we're aware of. It's Cedar Meats meat packing facility in Melbourne. It's actually down on some of the numbers we've been seeing from that cluster, 49 now linked to that one outbreak. We have around half a dozen of these people that have returned from overseas and are in forced hotel quarantine. So there's very little chance that any of those are going to pass that infection on to others. So those cases, while we don't like to see cases, are much less concerning than some of the others. We've also got about a half a dozen cases that are still under investigation. Now, that could be just that the contact tracers are still doing their work, and eventually they will link them back to one of the clusters that we know about or what have you. It may be that we have transmission that we don't know about. We just have to sort of wait and see where those cases get linked to. But they would be the ones that you'd be most concerned about. 5 in New South Wales of unknown origin at this point would also be ones that you'd be a little bit concerned about. The numbers are still low though. This is not necessarily cause for alarm. Let's just wait and see if this trend continues. We see this volatility when there are small numbers of cases. You can get very alarmed by one bigger number that comes out of the blue. We don't necessarily need to panic at this point.
No need for panic at all. Now take us through, there's an article on the ABC website this morning about the growth factor growing above 1 again. Talk us through that.
Yeah, and you can go online to the ABC website, the ABC News website, to read all the detail on this. But what it is basically is an attempt of, in some way, estimating the trajectory of our cases, in some way estimating the effective reproduction rate, the effective transmission rate of this virus. We've seen in this week more cases than more cases found this week than the previous week, and more cases indeed than the week before that. So this measure is basically just looking at crudely, how many cases are there this week compared to the previous 7 days. And what we're finding is there are more, and so that number is above 1. Now, we know that's largely been driven by this abattoir cluster in Melbourne. As that comes under control, and we hope it does soon, that number should come back under 1. If that growth factor that we've been reporting on stays above 1 for a very long time, well then we do start to get concerned that this virus is spreading in an uncontrolled way. If it stays below 1 or just or returns to be below 1, well then we are much more comfortable that we do indeed continue to have this under control.
And Casey, turning to Europe now, the UK in the past 24, 48 hours has passed Italy as the country in Europe with the highest death toll. Take us through what's happening there.
Yeah, so the UK on the official numbers has the most serious outbreak in Europe at the moment, with a lot of caveats on it though. So 256,000 deaths now, almost 30,000 in the UK. What we're seeing in the UK, distinctly different to Italy, Spain, France and the like, is a long plateau of deaths where we've really seen the death rate dropping in several other European countries. The UK has just sort of stabilised for a while, and we're hoping it will, it's dropping slowly, we're hoping it will continue to drop, but it's taking a lot longer to do so. The other thing I should mention, though, is we know most of these countries are significantly undercounting the number of deaths. And when we include all of those, I haven't done the analysis comparing all 4 of these countries, but when we do include them, we can expect all these to shoot up. I've showed you this chart before, Joe. We've got one new data point. It's updated once a week. This is the number of people, the number of deaths that are registered in England and Wales each week. The yellow is an ordinary year, the 10-year average of the number of people you'd expect to see dying. And we've got 1 more week's worth of data now in 2020, and we're seeing it's about 21,000 deaths. A very small drop on last week, but still around 10,000 more deaths than you'd expect to see.
Yep. Okay, Casey Briggs there.